When I first met Eric, it was in order to give him a psychological evaluation to determine whether he was, in fact, appropriate for our day treatment setting. And Eric was probably one of the most extremely hyperactive children that I've ever tested. During the testing, he was severely oppositional. It was really difficult to get him to complete tasks. He would insist that he wasn't going to perform, jump up from the table, walk away. Was an extremely active child throughout the entire session. In this case, there's clearly a biological influence with Eric's hyperactivity, that there is some kind of chemical or neurological disturbance that is helping drive this child. But the psychological testing also showed us that he's also very conflicted about his parents' separation and the social factors going on in his life. Eric attends our day treatment group for 5 days a week, 3 hours a day. And in that setting, we're helping him learn how to feel better about himself. That's one of the things that Eric came in with, was some very strong feelings that nobody likes him, he's no good, and he would make those kinds of statements frequently to the therapists. One of the purposes then of the group is to help him develop a more positive self-esteem by giving him positive feedback, helping him recognize his strengths.
On Eric's first day, he was rather quiet and solemn. He watched other children play with interest, but made no attempt to join them. He would turn his back towards peers and adults if they approached him. During a structured activity, Eric would be easily distracted.
He's really good about remembering the schedule and routine, hanging his jacket up, placing his lunchbox on a special shelf that we have for the kids' belongings. And then he'll really anxiously just run into the middle of the room, run in, "Hi, Shari. I had a horrible night last night. I got kicked out of gymnastics," and he just will immediately start telling me about the events that he had happened the day before. And then he will look up at me and say, "Do you still like me?" He's very needy of adult support. After we have this open free play, unstructured play, we go directly into washing our hands and having lunch. Any transition is very difficult for Eric. He does not really like to clean up when it is time to clean up, and he'll push the limits as far as he possibly can. Oftentimes during a transition, that's where you'll see the aggressive physical kicking, hitting, biting, screaming. The kids really do enjoy Eric when he is in a happy, pleasant mood. They do become fearful of him when he does get outraged.
Right now, Eric is working on a goal to work interactively with his peers, that he can express in words instead of hitting or kicking his peers. That if he could express in words exactly how he feels, that would be something, a way we would reinforce and we would praise him. Also, another goal is to increase his compliance, where he is actually able to be directed or redirected by us.